He's voted with us on women's right to choose, the environment, minimum wage, immigration, health research, and much, much more, including the deciding vote for President Obama's stimulus. And as senator teaming up with Senator Biden, Senator Specter saved the nation and the Supreme Court from Robert Bork. Senator Specter's constituent service operation is considered among the best in the nation and completely party blind. So even as a Republican, Senator Specter could be counted on to stand up for many of our progressive ideas. And the fact that he drove our conservative Republican friends crazy was an added bonus. Now Senator Specter is a Democrat, and our standards are a bit higher now. Since his switch, the senator has been doing all the right things. Almost immediately, he and his staff reached out to us. I met with his staff and spoke with the senator on the phone. I invited him to come meet with us here, and here he is. I suggested that he appear at a fundraising reception for us in the near future, and he and his staff agreed. I suggested financial support for our county organization, and he said, stay tuned. Most importantly, I told him that the most significant issue for Lancaster Democrats is the inclusion of a public option in health care reform. Senator Specter listened. Today, he supports the public option. Yay. It's an honor to introduce our incumbent Democratic United States Senator, Arlen Specter.
What is your position and you know, whether we can continue as a nation that has 100 million people that have limited access to health care?
Well, I start off with the proposition of covering the 47 million Americans who are now not covered. And I move from that to trying to structure health care in a way which will hold down the costs. I believe that we can benefit from the private sector and the public sector at the same time, and I believe that the competition is good. I believe we ought to put all the options on the table. The advantage of a public program is that it keeps as President Obama has said, it keeps the private companies honest. And the President wants a public option, and I'm prepared to back the President.
I've heard you speak a number of times on EFCO, the Employee Free Choice Act, and that you felt you had a compromise that would get EFCO passed. And I still don't know what the compromise position is.
The program that I would like to see done is to expedite the election. Right now, the elections take a very long period of time, and the employers wear out the union with intimidation, firings, having the discussions on company time. The employer has what they call a captive audience and brings in the employees and tells them they shouldn't form a union, but the union ought to have the same opportunity to speak to the employees. On the arbitration, to get a first contract, there are a number of modifications. One is to give the mediators authority to set the time and place, not when can you come in, but you will come in at this time. You will have a proposal. The other side makes a counter proposal. We want to have a discussion on the merits as to what you do. And if there is any obstruction by the employer, then that goes immediately to binding arbitration on last best offer.
Part of the stimulus package was adding $10 billion to NIH budget. And what you did, I believe you introduced a bill that would maintain that increased amount over the years, because NIH is basically under the Republican administrations has not increased the budget, and funding has not kept up with the inflation. So do you see passage of that bill or continuing?
Well, Bill asked about the National Institute of Health. I've introduced introduced legislation on what is called Cures Acceleration, or so-called Valley of Death between the laboratory and clinical application. And I want to get that included in comprehensive health care. Thank you all very much.